So, to answer the question of why didn't my mom's first physical therapy session go well? First and foremost, she's not thrilled about doing it. Mentally, she's fine with the concept. She knows it's to help, in this case, her arthritis. But it exhausts her due to her MS. And she's received physical therapy and occupational therapy on and off since 2003. So this isn't a new venture for us. It's just new for the arthritis diagnosis, where previously it was for her MS. So like I said, we have some experience and gut feelings about therapists and the companies, and this one was not a good experience. My mom last received occupational therapy at home in 2020, so that was the last time we started having anything, and then it's just been maintenance at home since then, and that was for her MS. In this case, it wasn't due to a hospitalization, coming home, or anything like that. It was to just fine-tune how she should be doing things, getting up and out of the chair, out of bed, how to properly use the walker. It was like a review, as well as some strengthening exercises to do. So with this current at-home physical therapy company, the coordinator and like her assessor, he was constantly changing the day that he was going to come to assess the situation. Every day he would call to reschedule, or he would be calling to say, I'm coming right now, and he couldn't comprehend why we wouldn't be okay with that necessarily. He was coming just as my mom laid down for a nap. He wanted to come just as we were starting homeschool, and it's like he couldn't fathom that there were still lives going on in this household, or that other things could be happening. Like my mom might have a virtual visit with her primary doctor, things like that. He couldn't grasp that our world wasn't revolving and waiting for him. It was a little off-putting. Literally the day he was supposed to come, he rescheduled like 5 times within a few hours. It was extremely frustrating. So when he finally came to assess my mom, assess the needs and the situation, he first comes in going, when did you get home from the hospital? And my mom's like, did you look at the prescription? Because the prescription didn't say anything like that. It said it's for arthritis diagnosis and for it to be light physical therapy due to multiple sclerosis. And he didn't even have the prescription on him, on his tablet or anything like that. So he goes, what are you have MS? Yes. And he goes, so does that mean you're a fall risk? Potentially, yes. And he goes, so are we here for your MS? No. And I explained she just got an arthritis diagnosis for her groin hip area on her right side, which is her weak side, and her primary care physician and her neurologist said to get physical therapy to help easing up the pain. We know it's not a cure-all, but to help with it. And then he laughed at us after I explained that. He said, oh, of course, doctors always want to do physical therapy for an arthritis diagnosis. So he did the cursory blood pressure, wrote down her medications. He's like, do you feel up to walking? Well, he was 35 minutes late and my mom was exhausted and it was into her nap time. And she's like, honestly, no, it's not going to be a safe situation. So he said, okay, I'll call you, or the therapist assigned will call you and schedule a time. And I said, how many sessions? And he goes, I have down twice a week for 3 weeks. And I said, okay. The following week, somebody called and said, I'm on my way right now. It was the crack of dawn in the morning and my mom was still asleep, like half asleep. And we said, no, we need some forewarning before anybody comes over. And scheduled it for like 2 days later. And she came over and came in and goes, so you just came home from the hospital? Came home from the hospital? it was like a deja vu. And my mom said, do you have the prescription? And she goes, no, it wasn't given to me. So we rehashed everything all over again. Not a hospitalization. She has MS, all this stuff. And she goes, okay, well, there's really nothing to do. I can just show you some exercises to do at home, but it's all about just keeping the area moving. Yes. And we had said, her primary care physician wanted her to concentrate on the times that the area hurts the most, which is getting out of bed and getting off of a toilet or a commode. And she's like, well, I'll just give you exercises to do. She wouldn't work with her in those scenarios to see how she's getting out of bed and what exercises could help the situation specifically. And she was giving a lot of exercises we were already doing back when she was doing occupational therapy. Plus, she gave a method of standing up and getting out of a chair, which was a method our occupational therapist had said never ever to do, and it puts her at a risk for falling. So that was a little off-putting, and I think it's because this individual was not familiar with MS and how it can affect people differently. How it affects my mom is not going to be how it affects another person necessarily. But even in the past with other physical and occupational therapists, most had no experience with MS, so it was hard to get therapy that was proper for her. So after she showed the exercises, gave a little printout to me of what she should do, I said, okay, when will you be back? And she goes, oh, it's just for this one session. And I said, I don't understand. She goes, well, because your mom's a fall risk, the assessor only put down for one session. And she said it really wasn't for arthritis, it was for strengthening. Like, he put down just to have a session for strength exercises, which is fine, but my mom actually has no problem with strength. She's actually extremely strong, luckily. It's just, her brain can't tell her body properly how to move. So he didn't even assess her correctly to realize that she's really strong. And it's like, let's use that to her advantage, but that's not the problem. It's not because she's weak, but he just assumed it because of her MS diagnosis. So she's like, well, I'll call you if I find out he assigns another session, but he's probably not. Okay. So I'm just looking up exercises that could help with arthritis, that are good for MS patients. And I'm doing those with my mom every day, in addition to what she usually does for her OT exercises she continues to do. But yeah, it was an off-putting experience, and we have a lot of experience with therapists, and my gut immediately told me this was not going to be the best situation, and it wasn't. So her primary care doctor wants some feedback so she can eliminate this company from her list and have backup reasons as to why she's making that decision. Because if he's not going to take, an arthritis diagnosis seriously, and if he's just going to make assumptions about somebody based upon their condition without accurately assessing them, maybe your place isn't the best. But yeah, she fusses about having to do her exercises, but she does them. But yeah, it was the place that wasn't great. So that's the story. Hopefully we'll get this figured out, even if she doesn't get any more therapy and I just do it. As long as it helps her arthritis, that's all we want.